Good morning and welcome to Creative Brain Week, the first full day. My name is Dominic Campbell. I am a host and will drop in and drop out throughout the course of the day. For those of you that get concerned by the fact I spend a lot of time looking at my mobile phone, it's not because my mum is ringing me. It's more because I'm checking in with the technical people and the queuing all sorts of people. We have a packed and interesting day for you. That will begin with an exploration of the neuroscience of kindness and then ladder up into practice. I'm going to get out of the way and I'm going to introduce you to your host for the first session, Professor Ian Robertson.
Good morning, everyone. It's a delight to be here with you, and thank you, Dominic, for the amazing organisation you've done to bring this together. I'd like to introduce my panelists today, very distinguished people. First of all, Temitope Farombi, who's one of our very esteemed global brain health fellows from Nigeria. Farombi, would you like to come in here? There we go. Thank you so much. And then I would like to introduce Professor Alejandro López, who's a professor in our Global Brain Health Institute, but he's an engineer, professor of engineering. We have really a wonderful multidisciplinary organization. So Alejandro, it's lovely to see you here. And then we have a global phenomenon called Professor Agustín Ibáñez, who's really delighted. He's a professor of global brain health in the Global Brain Health Institute from Argentina originally, but an amazing. Good to see you. The global phenomenon. Now, this session is about the neuroscience of kindness. Now, I'm going to steal 2 minutes to set the scene and tell you about a study that was done several years ago with 4-month-old babies. And they had the babies watching a puppet show. And there was 2 actor puppets throwing a ball to each other. And there was a 3rd puppet lurking in the wings. And occasionally the ball would fall away from the 2 playing. And the lurking puppet would do one of 2 things. Half the time would take the ball and throw it away. Half the time would give the ball back to the 2 players. And they measured how much time the babies spent looking at the lurking puppet. And they spent 3 times as much time looking at the kind puppet than to the naughty puppet. So I submit to you an argument against original sin and say that we are wired for kindness. And when people behave the opposite way to kindness, it's because of other factors interfering with something very basic and primitive in us. I'll just say one more thing. When they had robots doing this, where they weren't human, they weren't animate figures, it was just machines throwing the ball, that effect didn't happen. This was about attributing minds to people, and so that's in a 4-month-old baby. So I'd like to, having stolen the first 2 minutes of this half hour to set the scene, I'd like to ask Agustín if you could introduce us to the neuroscience of kindness, and then we'll move on.
Yes, it's a wonderful example, by the way, that you provided. So I will tell you 4 ideas. So the first one is a personal history, just to go against empathy towards kindness. Then I will talk about the neural correlates and why they matter more than, for fancy things that neuroscientists do, but something more important, and then what we can do with that, right? So the first history comes 4 years ago. I was living with my family in Argentina. We were having really hard times leaving the country, friends. Then we went to Italy for a short period, very unstable, and then finally we landed here in Ireland. So I saw my daughter, Bianca, now 8 years old, at that time I was 4, becoming extremely attached to her teddy bear. It was not just a toy, it was an anchor. It was, the only constant in, multiple goodbyes, strange cultures, strange streets. So one day we were in Bray, windy day, so we went to the train station and the teddy bear falling down in the rains, in the train tracks. So the face of Bianca was just despair, started to broken into tears, right? And then something really exceptional happened. You know, the guard there, he just, blew her wheels, stopped the train, halted the train, taking an extended arm, taking the teddy bear and returning to Bianca. So this is, for me, the difference between empathy and kindness. We all feel empathy for Bianca, especially us as parents, we feel the pain, but we didn't do nothing. The guy that we did something was the guard. So this is the difference between empathy and kindness. And this is the thing that happened in Ireland, by the way. But what about the neural correlates? So it's a really extended cortical, striatal, vagal network that is involved in kindness. We can talk a lot about, boring places in the brain. I think that the most important thing is to understand that these are areas that provide two things. So first, meaning, social meaning, connections with others, but also pleasure. This is the way that Ian was pointing at the beginning. We feel pleasure when we are kind. And this is why most of behavioral economy theories are wrong. I hope that there is an economist here so we can fight. Because they are based in the, individual maximization behavior. And they don't understand the metabolic impact of being pro-social. It's, like winning money, honestly. So the reward system activates like other areas like the insula, the periaqueduct rate, that are areas associated to social interaction are also activated. But also, happens something not only in the receiver, but in the giver. The giver, the people that constantly involved in kindness activity tend to have, let's say more complex or variable heart rate. That means better cardiovascular health, have, better immune system, reduced cortisol levels, have better sleep, so there are really benefits because we are wired for kindness. Why this is matter? I think that matter, first of all, because empathy is important, but empathy is about just feeling. But kindness is about action. Empathy can drain us, kindness can really sustain, empower us. Bringing the power of us. Empathy can also create burnout, when you suffer so much for the others without doing nothing. And even, in animal studies and also in social studies, when empathy, is too much strong, it reinforces the in-group and can be, a trigger of aggression against the out-group. Thinking now in our world that is full of in-group, out-group. So empathy can be very dangerous if we don't bring kindness. And what we can do a lot of things. We can train kindness, right? So we can just, doing compassionate meditation, kindness training. We can just, trying to be kind. That's it. We can use apps that promote prosociality. We can, stimulate the vagal, the nervous vagals to increase the kindness. We can do hyperscanning that I'm pretty sure that our colleague will tell us. Okay. But more important, we need to use kindness. You need to use kindness in the schools to reduce bullying. We need to do kindness in institutions, to really avoid, for instance, shame that happen in medical context when, senior fellows try to punish the early students. We need to bring kindness into companies to not only push productivity but also well-being. So going back to the Bray situation, the guard feel the empathy for my daughter, but he did something. He, do an incredible thing, a small incredible thing that transformed a trauma memory into a memory of love. So that's kindness.
Yeah, that's good. Very good. Thank you.
Nice.
Thank you. A lovely knitting together of the very personal and poignant with the scientific. Thank you.
I was so surprised about that.
Yeah. Alejandro, I'd love to hear your thoughts on this.
I think this is a very good way to get the ball rolling, because as an engineer, I care about definitions and I care about what is it that we are able to measure once we're doing science and research. But from the human perspective, those boundaries are very blurred in many ways. And you spoke very, very nicely about empathy and kindness. And I spent weeks trying to differentiate both and trying to understand, okay, what is empathy, what is kindness, and do they live in separate dimensions? And while I agree with your assessment that empathy can sometimes thwart kindness, I do think that they live in a continuum. And going back to the prosociality of things, kindness and empathy are signatures of our evolution. We're prosocial species, and that has helped us band together, create communities, create societies, and progress. The aspect of it is that there's a directionality to these actions. So you are kind to someone, and someone is kind to you. So to understand that, we really want to be able to see when these links are developing, and what can we do to strengthen that developing of those links. This week and last week, particularly in Ireland, is very topical, the concept of kindness. And I don't know if you saw the documentary of RT Investigates on nursing homes, for example. And that really brings this narrative into context, right? Say, empathy versus kindness. They can understand what the residents of the nursing homes are going through, but kindness has become a commodity. You get paid to do a job that somebody else cannot or doesn't have the time to do. And that is something that we need to address. And how we want to address it is by evidencing that there is a behavioral link that benefits everybody when it develops. Professor Sisifu, yesterday, for those of you who were here yesterday, she mentioned this game, The Mind. And I was delighted to see that she was using it on Creative Brain Week in Singapore, because she talked about a game that people need to work together to win it. And this is the first game that I used in my social interaction experiments. And I could see that the brain of people interacting in a group towards a common goal synchronize in a way that they don't when people are sitting in the same space but doing a different activity, like a puzzle, like a Sudoku, like something else. So it's not about just being in the place together. It's the interaction together, is strengthening this kindness links. But I'm still not sure whether I can break it down or separate it from empathy. And that's where I really like the discussions around this, because there is plenty of confounding links between these two. And until we figure out a way to understand it entirely, we cannot provide the evidence that we want to provide fully. But my hope is that by supporting those who cannot speak towards kindness anymore, by providing evidence that there's still a kind link developing in that interaction, we can make sure that people protect those links and avoid making kindness a commodity, because that is one of the risks that I think we're facing at the moment. And it is what makes us paradoxically more isolated than joined together.
The Walmart smile.
Yes.
Thank you very much, Alejandro. Yeah, thank you. Yeah. Temitope, can't wait to hear your perspective on this.
Thank you very much. I'm a neurologist and I practice in Nigeria. So I'm going to be talking about kindness in the doctor's room. Thank you, Agustín, and for how you have actually made this discussion to evolve. And one thing I'm picking from empathy is your feeling, but kindness is action. Hello? Okay. Yes, but kindness requires action. And as physicians, they ask us to show empathy towards our patients, and and beyond just empathy, there's an importance of reaching out. And for me, touching in clinical space is an act of kindness. I can have the way the physician table and the doctor's table and the patient sits. It's very difficult to even reach out to that patient. Mm-hmm. You just want to sit down and listen to them, except only when you want to do examination that you say, okay, come to the examination table. And that's, for me, it's not an act of kindness, but empathy. However, we can use touch. I know we have different cultures here, I come from a culture whereby we do a lot of touching. Mm-hmm. And I know some culture, they kind of, there's this concept of a private space.
Personal space.
Yeah, personal space. But then, how do we bring touching into the clinical space without eroding into individual personal space on how people perceive that? Can I go to the next slide, please? Next slide. Okay. So incorporating this also in the clinical space helps to improve how we effectively reach patients. My personal experience, I'm going to be talking about that on two case scenario where I applied the act of touching in form of kindness to patient. And these are the next slide. These are the things that I experienced while doing that. Yeah, it enhances patients' healing, and also it builds trust and connection, as well as it makes them relax and they always want to see you. Let me tell you, if a patient comes to the clinic and the first thing they ask of is a particular doctor, it's because that doctor is kind to them and made them feel homely and being felt and seen. And the doctor has gone beyond just seeing the patient in front of himself or herself as someone living with disease, but has treated that person as human being like himself or herself. And that is what we need to start bringing to our clinical space. I know Arasima mentioned yesterday that what makes it very difficult is that we shorten the time that we spend with patients, now 10 minutes, 15 minutes max, and other patients are waiting, so it's very difficult. But then, how you make people feel goes a long way in making them feel better. Also, next, so I'm going to now print this in two scenarios, which is, I'll be talking about two cases that I personally experienced, and that goes to the next slide. The first one is Mr. Hay, who was diagnosed with Parkinson's disease 3 years earlier. And but he felt something. He initially was taking his medication, but then he stopped taking medication. And he became grumpy and irritable towards his wife. And yet they were in my clinic, and the wife just, he's not listening to anyone again. Tell him, doctor, he doesn't even want to take his medication. I'm tired, I'm frustrated. And then I looked at this man's face. It was very sad. And I reached out and I touched his hand. And I looked at him. Mr. Hay, how are you today? His face lightened up. And the first thing he said was, doctor, you touched me. I got taken aback by his response. You touched me. I said, yeah. You don't like that I touch you? No. I have not been touched in the last 3 years. Even by my wife. Everybody treats me like I'm a disease, that I have leprosy. Nobody wants to interact with me as human. They see me as my disease. And this is a 62-year-old man. So I had to explain to the wife. But of course, I'm not going to blame the wife. He is trying to protect him. And she's trying to protect him with our limited understanding. But she felt, he's got Parkinson's. He can't fall easily. He can't hold his utensils anymore. So I need to guide him. So the part of human connection decreased between them. And that made the man very grumpy, very irritable. He felt less than a man in his own home. And I educated the wife that you can touch your husband. You can still show him love. He's still the man you loved. Don't start treating him like somebody who is sick, but that man that you loved. The next time I saw them in clinic, oh my God. It was the wife that called Dr. Farombi. And the husband was very happy. He said, oh, doctor, I take my medications now. We went on a visit to people's houses. And now I feel that I felt seen in my own home. So that is an act of kindness. I could just, as a doctor, just give him medication and not look at that extra part of him. But going out of my way to touch him changed everything, and that ministered to me even personally. So that's the reason why I go out of my way to do extra thing, even if it means touching them in their palm, just to bring them closer and then making them feel relaxed. So this is the second one. That is in doctor's room. The second one is in the community. And this is an older woman. I don't know her. But she's got Alzheimer's disease and she wandered away from her home into a different environment. She's been away for 3 days or more. She's dehydrated, she's hungry, and she became delirious. And then the community around her were very hostile, thinking that she's a witch. But somebody heard us, because we normally do radio campaign about symptoms of dementia and people not treating them better. People should treat them better. And then called us. And I stopped being a doctor and I became a rescuer. So I left what I was doing and I ran to the community to save the woman. We sat her down. We gave her Coca-Cola and some biscuits. She felt better. And she was able to tell us her address and we were able to reconnect her back to our home and family. And they broke down in tears that we've been looking for her in the last 3 days. So that is the act of kindness that we see in clinical space. Of course, I know that the social worker feels that, okay, that's where their work should be. But as a clinician, like Agustín mentioned, it's okay to feel empathetic towards someone. But taking that extra step to reach out, to touch, goes a long way. And that's my own concept. Thank you.
Thank you very much, Temitope. There was 2 things you mentioned there, Temitope, that just rang bells with me. One was Mr. A felt seen. I mean, and if you're touched, you felt doubly seen. But there was a study done with random people in the street by some German researchers, and they just went up to people and said, "How connected do you feel with other people?" Just the randomers in the street, and they did a rating scale. Then they did a randomized trial with complete strangers walking by strangers in the street, and half of them met the stranger's eye for a millisecond as they passed them. And half of them, there's a German phrase, wie Luft betreten, which means to treat someone as if they're air. Mm-hmm. And you don't look at their eyes, you just look at their face and you don't meet their eyes and go back. And the people who, with the complete strangers, who had that experience of not nearly but not meeting someone's eyes as they passed, felt less connected to people. And these were complete strangers. So what's it? And then touch is something we just so underestimate. The other thing I was going to say about touch is a study in Stanford where they put chili powder on the skin and they got a big wheel, and then they had a doctor coming in, a fake doctor, who was very doctory in white coat and mechanical and technical about it, and put a neutral cream on it, a neutral cream on the thing. And then another doctor who came in who was, "Oh, my name's Joel," and was kind and present in the way you were, put the same neutral cream on it, and the wheel went down much more just with the kindness. There was no active agent there whatsoever. It was just the kindness and the healing qualities. And I think with artificial intelligence coming into medicine, doctors are going to become healers and use these real physiological powers to improve the brain. Anyway, I've stolen far too much here. This kindness, empathy is so interesting. I mean, and it's about action, isn't it?
Exactly.
It's about compassion is different from compassion entails taking action for someone, not just feeling the empathy. And you've discussed how do we increase this? Boy, do we need it in society. People are isolated. Yeah. I mean, Alejandro, you weren't so keen on that distinction between kindness and empathy, or compassion and empathy. Let's think about it. Yeah.
Yeah, no, absolutely. I mean, it's we are directed in many ways, and Agustín was talking about the in-group and the out-group, and we naturally gravitate to an in-group in that way. So how do we promote that we expound our boundaries? And there's no other way other than training. And you can train kindness, and you can train effective empathy as well, without it being distressful, but to understand where people are feeling, how they're feeling, and what can you do to make that sensation better. So understanding those roles, it's crucial in that way. But in a lot of the settings that we face, particularly when we talk about brain health, treating of people with neurodegenerative diseases, we lose a anchorage because we don't get the same feedback loops that we normally expect from healthy individuals. So how do we help people understand that these bonds are still forming? I had a brilliant discussion with Nick Johnson about using theater to promote empathy and to teach empathy. I was like, well, one of the things that I would ask here is an actor is trained to convey emotions without necessarily feeling those emotions. So how do we do the opposite? How do we actually train to generate those emotions? Because you need them to be kind. And while kindness is the action on top of empathy, you do need to feel that empathy to be moved to act, isn't it?
Exactly.
Yeah, absolutely. So, yeah, don't make me wrong. It's because I have heard so much about empathy at the GBHI that I want to bring another pro-sociality-oriented values, honestly. But, empathy, we need empathy for kindness, that's for sure. Empathy is the trigger. Is this how it sparks, right? And it's very important because, as Ian mentioned in the example of the beginning, empathy allows us to feel the others in a very spontaneous way. It's just not feeling the others. When you see others suffering, you activate your proprioceptive centers in your brains, regions associated with your own pain. So you can spontaneously feel the other suffering. But it's also fairness. When you see other people that is suffering an unfair situation, you have the same activation. So this is why empathy is so important. But if you don't do something, it could be really bad. That's the point.
It can be a burden.
Exactly. Let's give me an example of very, animal-oriented design. You have two sets of rats coming from different breeds, different cultures. If you give the hormones of empathy, oxytocin and vasopressin, what do you predict that is going to happen? Empathy, probably. What do you think?
To the in-group, perhaps, maybe not the out.
Too old. You give oxytocin and vasopressin, so it's like a happy new world for rats, right? What do you think that happened? More empathy? Well, no. It's quite the opposite. More aggressions against the out-group. Yeah. So because empathy creates bonds with the more close people, So this is, and this is doing a very, artificial way through inducing a chemical, right? So no action. So this is why, at the same time, burnout, so many, clinicians, therapists, couples, they feel exhausted with empathy.
And that's why I guess the Christian doctrine of love thine enemy was such a major, a major step in humanity. Temitope, can empathy be a burden? As a clinician, for example?
It can actually be a burden.
Yes. Yes.
Because, it can actually be a burden because, especially when you don't, when you kind of internalize it, and then it gets to a point that you oversaturate yourself in terms of the exposure to the stimuli, and you just want to do your work and go away. And that can actually also lead to burnout, even for physicians. So you can't give what you don't have. You need to also be kind to yourself. Most physicians are not kind to themselves. They kind of, they've made empathy in a form of duty and then neglect themselves in the line. Saying even there was a study about a physician in accident and emergency dying earlier than even physician in other specialties. And you could say perhaps and that was a study that was documented. So empathy is good, but if it is overstimulated and there's no escape where you need to internalize and then go out of those environments, it can lead to burnout and have negative effect on you as a physician in workplace. But then, as a physician, you need to be kind to yourself. You need to, and being kind to yourself means taking action. Action. Yeah. Internalize whatever you've learned and then try to take care of yourself, your emotion, your mental health, even your physical self. And then you have that enough reservoir to reach out. So, and not only physician, even to others. I know I would like Agustín is very busy. He works 24 hours, 7 days. And occasionally, I've seen him also go on bike, and that's a way of being kind to himself. Yeah. That's, at least he's not on his computer when he does that. Yeah. So,
I think that's a key point. It's not only as a physician you need to be kind to yourself. As a human being, you need to be kind to yourself. Everybody needs to be kind. Because one of the things about depleting empathy or burnout or internalizing is it's a consequence of us not having our own outlets as well. Yes. Us not having that continuum in it. So if this was an ideal world where everybody's kind or everybody's empathic and kind to everybody, then what I spend on someone else gets spent on me as well. And that renews the cycle. So I think the message and the promotion here is pay it forward.
Yes.
Because that helps the wheel keep turning. Right.
It's not a zero-sum game. Look, I'd love to go on with this discussion. It's really been, thank you so much, Temitope, Alejandro, and Agustín for a fantastic discussion. Thank you very much.
Thank you, Ian. Thank you all.